Hi, my name is Kara. I'm the clinical director at Grow Through Life Counseling, and just wanted to talk to you a little bit about some typical cases that we treat here at Grow Through Life to see if this might be the right place for you. So in case one, a 9-year-old was presented with excessive lying behavior by the parents, and they weren't really sure what to do. So in this case, we would take a child development history, look at environment, trauma, where did the lying start. At some point, it must have been positively reinforced because it became a maladaptive coping skill that went forward. So what we need to do is address what the underlying why is and then teach alternate coping skills. We also work with parents on a behavior modification plan to reinforce positive choices and decrease the lying behavior, eventually eliminating the lying. So there's a lot we can do with that type of maladaptive coping skill in counseling. In the second case, it was a 23-year-old female who presented after dropping out of college. She was experiencing a high level of anxiety, really afraid to make choices about her future, unsure which path was for her, and feeling like her friends went ahead of her and she's now left behind. So the first step would be to decrease anxiety and stabilize, giving her alternative coping skills, talking to her about self-care, promoting self-esteem by evaluating her interests and values, and then looking at how that correlates with her goals for the future, and then problem solving and setting a plan in place so she could take some steps forward. In the third case, we work with families who have conflict, different parenting styles, or maybe there's even been a divorce and they have noticed their child is acting out. So in this case, we would assess both family styles, both parenting styles, and address where the differences are, which can create confusion when kids are developing and trying to follow different rules and different consequences, maybe in two different households. And we would work with doing any healing necessary to lower the resistance for the parents to co-parent, and then work on a plan where if there's two households, the rules and boundaries are consistent. So just to give you an idea of 3 cases that we would typically work on. And then the broader categories that we work with: behavior problems, emotional problems, or social problems, as well as any stage of life adjustments, transitions, or grief and loss. If you have questions for us, call us at 619-549-0329. And for more information, you can always find us online at growthroughlifecounseling.com. We have 2 locations in San Diego. We're in Chula Vista and the Del Mar Carmel Valley area. And I look forward to hearing from you soon. Thanks.